Good day to you all. My name is Dr. Nadav Pam and I am a clinical director in Forma-TK company, and it's an honor to be a guest for Dermaspark in the Canada branch. And today we are going to speak about the treatment of with the alpha system with the IPL handle S430 to treat acne vulgaris. So what is acne vulgaris? It's a chronic inflammatory skin disease of the hair follicle of the pilus sebaceous unit that occurs when dead skin cells and oil from the skin clog the hair follicles. It's characterized by different combinations of papules, pustules, nodules, cysts, and scarring, the end result, unfortunate one, and often accompanied by seborrhea, and it's a common skin disease in adolescents and in dermatology clinics. It primarily affects skin with a relatively high number of oil glands, including in the face, upper part of the chest, and back. The onset of acne vulgaris is closely related to age, and although it can occur at any age, its peak incidence age is concentrated in the 15 to 24 years old age groups. It can happen in both sex, male and females, and hormone called androgens appear to be part of the underlying mechanism by causing increased production of sebum. Another common factor is excessive growth of bacterium of Cutibacterium acne, which is present on the skin. In 2015, they did statistics and found out that acne vulgaris affects approximately 633 million people globally, and making it the 8th most common disease worldwide. The statistics may change in numbers, but all around the world and including in Asia, the acne phenomena is a major concern for those age groups. Some rural societies report lower rates of acne than industrial ones. Although acne becomes less common in adulthood, it persists in nearly half of the affected people into their 20s or 30s, and a smaller group continues to have difficulties even in their 40s. In the face, it affects most everyone. In the back, more than half, and chest, only 15% of the people will suffer from acne. Acne in chest and back is considered harder to treat. So what are the factors contributing to acne vulgaris? Hypersecretion of the sebum, abnormal proliferation and differentiations of keratinocytes in the hair follicle, and bacterial colonization, and host inflammatory response. Right now we will see a short demonstration.
All acne starts in the same place, with a hair follicle, which is a small opening in the skin from which a hair grows. Each hair follicle is made up of 3 main parts: a follicle shaft, a hair, and an oil-producing gland known as the sebaceous gland. The skin cells that line the follicle shaft are replaced by new ones every 28 days. In acne, the cells lining the follicle wall produce too much keratin, a substance that helps to protect the skin from damage. This excess of keratin can cause the dead skin cells to stick together, making them harder to expel from the follicle. Cells that are not expelled from the follicle mix with a flow of oil that is produced by the sebaceous gland, a gland in the skin that produces oil to keep your skin moisturized. Together, the dead skin cells and oil can form a blockage in the hair follicle. This plug of cells and oil is how most acne begins. Although sometimes the blockage can come from outside of the hair follicle, when substances such as sweat, makeup, and oil on the skin surface enter into the follicle's opening and become trapped. As the oil from the sebaceous gland, known as sebum, continues to flow towards the surface, it begins to build up behind the blockage, making it larger. Bacteria that live on your skin and inside your hair follicles find the oily blockage an ideal environment and begin to multiply. As the blockage grows, it can create a split in the hair follicle wall. White blood cells rush in to fight the bacteria inside of the blockage, causing inflammation of the surrounding skin and a pocket of pus to form, which is made up of dead white blood cells, bacteria, and other debris.
Okay. So I'm going to go through with you on the different types of skin lesions. So we have whiteheads, which are basically closed plugged pores. So this is a whitehead. We have blackheads over here, basically oxidized, and the papules is like, looks like that. Okay, and you have milia, which are different forms. Okay, and you have papule, which is the biggest one. This is a closed comedon, and a cyst. It's can be painful with pus. Another short video. It's here.
Nearly every teenager has looked in the mirror in the morning, only to discover a huge zit staring back at them. Your skin is porous. It's filled with millions and millions of tiny little holes, or pores. In the skin, glands connected to these pores release a pale yellow oily substance that lubricates and protects the skin. This oily substance, called sebum, is one of the main causes of acne. Although it's essential to keep our skin soft and pliable and our hair shiny, too much of it can be a problem. Especially in teenagers, large levels of a sex hormone called testosterone are produced, which causes the skin to release a lot of sebum. Sometimes, this excess sebum can clog up the pores. Adding to the mix are dead skin cells. A total of about 30,000 skin cells are shed every hour. A lot of these skin cells are shed inside the pores themselves. A blocked skin pore also contains bacteria. They feed off dead skin cells and the clogged sebum within the pores, producing toxins that damage the lining of the pores. As these bacteria grow and multiply, they invade the area surrounding the pore, which can lead to a bacterial infection. A blocked pore initially turns red because blood rushes to the site, which is one of the ways our bodies respond to infections. Then, white blood cells, a type of blood cell responsible for fighting infection, destroy bacteria, build up below the surface of the skin, and eventually die. These dead white blood cells, along with dead skin cells and some bacteria, form a white liquid known as pus. A pimple forms when the excess oil and dead skin cells clog up and block the opening of the pore. This type of pimple is called a whitehead. Another type of pimple, called a blackhead, appears when sebum and dead skin cells clog the pore but not the opening as in a whitehead. While the pore is clogged, its surface remains open. These pimples appear black because melanin in the dead skin cells reacts with oxygen from the air, which changes the melanin's color from brown to black. Washing your face with soap and water several times a day is a good way to minimize acne. That said, once acne has developed, no amount of washing will remove it. At that point, acne is due to the bacterial infection, and
So right now we learned about acne and bacterial infection. So most people would like to know how long will their acne last, but the truth is nobody knows. It's individual. So there are some ways to try to determine, or there are some criteria that will show maybe in your case it will be longer. So if you have family history with your family parents, one of them that had the acne for longer time, then you might be predisposed to having it longer. If you had it as an early onset, I mean you got it before puberty, then you might have it for longer. And so really it tends to be individualized, and we know that women tend to get adult acne more often than men do, but men usually get it even stronger than some of the women, but really it's individualized. So is acne connected to other diseases? The answer is yes. And acne can be related, like it can be the tip of the iceberg. That means that other diseases may cause a lot of symptoms, and acne is just one of them. So when you ever encounter a patient that has a stubborn acne, you always have to think, wait a minute, maybe he has other diseases, and acne is just the first one that we observe. So they found a connection to insulin resistance and to develop of severe acne, and also the metabolic syndrome. If somebody has obesity, he has polycystic ovaries, then he might have more hard to treat acne, what we call resistant to treatment. Is there any other genetic diseases or syndromes that are connected with acne? And yes, there is. And you see some of the list here: Papa syndrome, PASH syndrome, Sappho syndrome, adrenal and ovarian tumors, and also interleukin-1 diseases that are connected. So basically, the acne will be extremely hard to treat and will come again and again, because the genetics, you don't change them with the normal conventional treatments. So this is just for you to know and to broaden your spectrum of the acne phenomena, that whenever you meet resistant acne for a patient, always have like a red flag and think, maybe I need some more details and more examination and to find out why it is like that. So then we have another question: how do we grade? How do we say that, okay, this acne is considered mild and this is moderate and this is severe? Because for each patient, maybe one acne is the end of the world for them, and what is considered almost clear. So even today, we don't have a standardized way that is accepted by all the countries, that okay, this is the way. But we have something that is borderline accepted, and that is very old. So it's the grading of 1 to 4, which you can see here: grade 1 like that, grade 2 like this, grade 3 like this, and grade 4 it's severe. So how did they calculated it? So basically it was by counting lesions, and then they said, okay, if I have acne with just comedones, then the severity of it is if I have less than 10, up to 25, or more than 50. And if I have acne with papules and pustules, the same. So it was the number. Newer attempts to do classification are what are the size of the nodules, and not just like what are the numbers of it. So if you have a lot of inflammatory lesions that are above 5 millimeters, or one big nodule that more than 1 centimeter, it's enough to make you go into the more severe types of acne, and not just by the total number of skin lesions. So even one can be very severe, or a group of ones that are distributed on a specific area, like you have here, for example. So we know that once you have acne, you need to treat. Why do you treat? To avoid scars, because the scars are very hard to treat later on, and it's like a gift that keeps on giving, and we don't want that kind of gift. So what are the tips for skincare? So in order to keep your skin clean, gently wash your face twice daily and not more than that. Choose gentle, non-abrasive cleansers. Choose the right skincare for you with alcohol-free. Shampoo regularly. Stick to your treatments. Keep your hands off. That means part of the treatment is also educations of the younger people that try to manually squeeze everything, and then they can do scars, and it can be even go to post-inflammatory hyperpigmentation later on after the acne goes away. And protect your sun by avoiding excessive tanning. Another phenomenon is basically drug-induced acne or drug-induced acneiform eruption. We can see it with people who take corticosteroid and suddenly stops. Then you have acne burst some days later on. So you treat the acne, and it's basically a side effect of the use of the corticosteroids. There are other treatments here, but for the other spectrum is the adult one, that people in the 50s, 60s, 70s, if they have cancer and they are usually using as treatment EGFR antagonists, then they might have drug-induced acneiform eruption that might last, and it might mimic acne and behave like acne, but it's due to the treatment. Sometimes it's non-reversible, and sometimes it is, depends on the mechanism of the cause. But just so you know, drugs can cause acne or acneiform eruptions. What about acne in pre-adolescent children? So usually we don't need to perform microbial test or laboratory investigation, except in cases of acne-like or acne resistant to treatment, which contains folliculitis of gram-negative bacteria. Usually, if you have acne in pre-adolescent children, you have here a guide, like tip on how to approach it. So if acne happens to be in between the ages of 0 to 2 months, usually it's normal unless it has also secondary sex signs and accelerated growth. What do I mean usually normal? The baby is born, he was exposed to hormones from the mother. Usually if you don't have the secondary sex signs and accelerated growth, then you might have neonatal acne, and it will fade away because the hormones from the mother goes through the placenta and affects the baby, and it will go away. If you have acne at the age of 2 months till 12 months and it's accompanied by sex signs, then yes, then you need to start going into consulting with endocrinologist. If you have acne at the ages of 1 year to 7 years, which is called mid-childhood acne, then also you need to start a conversation with children endocrinologist. So what kind of investigation you should do? A growth curve and palm photograph of the bone age, and consult with your local pediatric endocrinologist if you need to do further examinations. So normally acne with no other any other signs of, let's say, bad odor from the armpits, clitomegaly, or axillary or genital excess development, or thick voice, then if it's just acne, then don't worry so much, it's enough a dermatologist. But if there is secondary things like that, like I mentioned, then yes, also consult your pediatric endocrinologist for further investigations. What about for the adolescents? So in males, you can use the pediatrician. It depends on the country. In Israel, for example, pediatrician is until 18 years old. And then you have family doctors from that point on. So in males, you need dermatologist or endocrinologist in case you have additional signs. In females, you also need to consult a gynecologist. So what special attention you should take care if you have females with acne vulgaris over the age of 25 and the acne is stubborn and combines one of the more of the following: irregular menstruations, androgenic alopecia, clitoromegaly, and fertility problem, and abdominal obesity, then you should consult endocrinologist and gynecologist to find out the other causes of acne. Here I just wanted to show you which kind of lab test we can do and which lab test is connected to which disease. So for example, if you have ACTH simulation test and you have increased 70 hydroxyprogesterone, then this will refer you to androgenital syndrome. If you have increased DHES, then if it's decreased, then adrenal hyperplasia. If it's increased, it might point you towards the adrenal tumor. If you have a free testosterone test and it's above 2 nanogram per milliliter, maybe it's ovarian tumor. If the LH/FSH ratio is above 2, then you have PCO syndrome. Other examination maybe refer you to insulin resistance. So that's why all these examinations should be in the context of with the endocrine and the gynecologist to see if it has any relationship, and acne can be just one part of the manifestations of those disease listed here. So when do we do the test? So females should do the test 3 to 5 days after the period, and you should consult dermatologist, gynecologist, and endocrinologist. The gynecologist should check for PCOS. If you have PCOS, your acne might be more resistant to treatments. So another topic that is controversial: is there any connection to hormonal activity, food, and acne? So it comes in with a lot of questions, and we don't have an absolute yes, but from what we do see is that if you have food containing high glycemic index, then it can affect your acne. And for example, foods that that came from milk of cows, for example, if the cow got all the time artificial hormones, then these hormones don't break down and they go from the milk to the consumer. So then you have in your body circulating hormones from the cow, and for some patients that kind of food might trigger acne. So we have here a test that was done in 2007 by the American Society of Nutrition, and they tried to treat acne or improve the acne vulgaris just with low glycemic load diet. If you want to read more, then you go to the glycemic home, and for some patients, change of diet that is specifically for them with low glycemic diet could improve the acne on its own. So it's something to think about. So when you want to choose the treatment for acne vulgaris, you face with a lot of information. You have topicals that are, let's say, cosmetics. And then you have topicals which are considered medicinal, that only by doctor's prescription. And then you have drugs that only a doctor can prescribe. And then you have IPL. And then if you have acne scars, then you have the CO2 or other ablative techniques. So what are the general tips on how to approach to treat acne vulgaris? So first of all, you need to speak with the patient and explain to him that acne vulgaris is prolonged and there can be on and off periods. Sometimes it will be better and sometimes it will be worse. If you're going to treat a woman, so the first thing you should ask her, is she pregnant? Is she planning pregnancy? And is she aware if she is pregnant or not, especially if you want to prescribe oral antibiotics or any type of oral retinoid, but also it needs to be talked about, okay? Even if the child doesn't have a sexual partner, as long as she's in childbearing age, this thing should come up, and you should clarify that each medication might be a problem with pregnancy, and that's part of the education. So you always have to ask, even if the patient is not planning right now or is not aware of it, she should be informed about the possible outcome of what happens if she does get pregnant and take those kinds of medications. So if it's a mild case, you want to treat it locally. If it's moderate to severe, then you should consult your family doctor and dermatologist about oral medications and to plan when to treat them with them, and also to do blood tests before, during, and after. Depends on the antibiotics. What do we know about cleansers? So although acne is not associated with poor hygiene, the role of facial soap in the treatment of acne hasn't been proven in studies. It was found that about 70% of the patients use a specific cleanser market for the skincare, even though it wasn't shown that it will work. And even in the previous video that I showed you, once you have acne active lesions, soap won't affect them. But soap can affect the epidermal barrier and basically clean it in the areas that didn't have acne so far. So cleansers, according to our data, won't help, but still, nevertheless, people will buy them and use them. What about peelings? So peelings has several degrees to them. You have mild, moderate, and deep, what we call. So deep can only be done with doctors and in anesthetic with anesthesiology and in operation rooms, because it's very risky. And mild and moderate, it depends on the percentage that you are using and what is prescribed in your country and what is considered cosmetic, and from a specific concentration it will become medicinal, so only a doctor can prescribe them. So it can help locally, but you should know what you are doing with them so you don't do more side effects than good. So what about topical treatments for acne with a prescription from doctors? So we have topical benzyl peroxide. In different countries it's known by different names. So benzyl peroxide will be the generic name, and the commercial name might be different. So in Israel, let's say it's Oxy 5 or Oxy 10 according to the concentrations. So it can be added to ointments, soaps, and lotions, and in each country you have the degree of concentration from which it can be over the counter, and a concentration that beyond that it's only with doctor's prescription. So the benzoyl peroxide has several common side effects. It dries out the skin, it may irritate or tingle the patient's skin, may whiten clothes, and may increase skin sensitivity to the sun. Usually we want to treat acne with more than one type of let's say ingredient. Why? Because you don't want to create resistance from the bacteria. Okay, I will go into it later. Another topical is the Zindaclin antibiotics, which basically contains clindamycin. It's effective against the bacteria that causes acne. You apply it once a day in the acne affected areas, and the doctor should tell you how to use it. And benefits can be seen 4 to 6 weeks for using Zindaclin. It's usually for mild acne. What about topical retinoids of vitamin A derivatives that are also suitable to treat inflamed lesions, but only with prescription from doctors? The mechanism is basically a comedonolalytic, so it's keratolytic activity and anti-inflammation action, and indirectly it's antibacterial against the P. acne, and you can use it in combinations. So there is a lot in the market that sometimes they are using vitamin A with benzoyl peroxide, and then you have several drugs that are topical for use for this kind of combination, but are usually with doctor's prescription. Different types of vitamin A derivatives have different receptors. You can see here some of their names, and they target different receptor of the vitamin A. What else I wanted to tell? So you need to remember that if you treat somebody topically, you cannot do IPL for the next 2 weeks. So it's something to think about. And also ask the patient prior to IPL treatments. In addition, we have minocycline, which is basically an oral drug that works against the bacteria that causes acne. What are the things to consider when you are taking it? It should not be taken during pregnancy. It should not be given under the age of 12 years old. Also, you need to take blood test prior to the drug, during and after. Also, you should not go to sleep after taking the drug. You should stay in supine position because it can cause irritations and ulcer to the esophagus. And also, you should remember that minocycline have another side effect. It has 3 different groups. One that can cause blue-black discoloration in the areas prior to the inflammation, such as acne scar type 1, blue-gray pigmentation of previously normal area of the skin, like lower legs, type 2, and uncommon muddy brown hyperpigmentation that is mostly emphasized in sun-exposed area, type 3. So sometimes it can happen just by one single dose, and sometimes it can be accumulative. So the more you take it, the more chance you'll have it. The cutaneous hyperpigmentation may take months to years to fade after minocycline use is discontinued. So what do I mean? That you might wake up and you might have this bluish discoloration in different areas. So there is some cases. So although minocycline is clinically good drug, it should be considered if we want to be in this risk. According to the literature, it's like 1 to 100,000 of people who are taking the drug that one of them might have it. But in my opinion, it should be thought if we actually want to use this drug, and at least to inform the patient about that kind of irreversible change of the pigment. Another drug is called doxycycline, which is an oral antibiotics, trade name doxylin. It's like minocycline from the similar family, and you should also not take it when you go to sleep. You should stay awake and take with 2 glasses of water to avoid esophagitis and ulcers. You should do blood tests before and after. Both minocycline and doxycycline will not help to reduce your acne in the future. It will only treat active lesions. And what about the most famous drug of all? It's oral isotretinoin. It's also known as Curatan and names like that. In higher doses, around 30, 40, 80, and cause dryness of the skin and mucous membranes, eyes, mouth, nose, and vagina, and can increase blood fats. So before you take this drug, you need to perform for males and females blood test before to show that your liver is okay, kidneys, electrolytes. Females also have to take a pregnancy test, and if they are sexually active, then they have to use double preventive contraceptions. Why? Because we know this drug is it causes fatal abnormalities in the embryo, and we want to avoid it as much as possible. So first you have to inform the patient that even after 1 month of use, you still have to use the double contraceptions. You cannot donate blood after using the medication for some months. It changes according to different countries. And you should avoid 6 months after stopping the drug any cosmetic treatments, also IPL. And so it's a very effective drug, and you should know that all the limits from when you can take it. Also, for some people, they can't use it because they have sports and activities that is contraindicated while using this drug. So it might not be good for them to take, or if they can't use it because you need to take it for half a year or a year depending on the dose, and they have jobs that they need to be in the sun, and they cannot use this kind of drug at that time. Also, it's not a miracle drug, because some people think, oh, I will take that and my acne will go away forever. Some of the patients need to take more than one course of the drug during their lifetime in order to enjoy all of the benefits of it. What is the main advantage of Curatan is that it will decrease the sebaceous activity of the gland, and then your next acne eruption will be milder. But today it's one of the most common drugs used to treat worldwide for acne. What can we also do to treat acne? Only for females with a gynecological observation, they can also use a cryptoacetate 2 milligrams with estradiol, ethylene estradiol. So basically, those are sex hormones with estrogen and androgens, because they play an important role in the development of acne in men and women. So in women, you might take them, and it will decrease the milk production and change the radiation of the follicle opening and prevent the follicle obstruction. So it was found that it can be useful as an additional tool for women, but only with the guidance of a gynecologist prescription that explains about it and explain that it might take 3 to 6 months from start of the treatment to see any results, and to make sure that the patient is above 12 years old, and the contraindication is history or suspected of hypercoagulation, liver disease, and smoking over the age of 35. What about acne vulgaris and social habits? So acne can impair quality of life and self-image. Severe acne can cause them to sink into depression, anxiety, and God forbid for suicidal tendencies. Severe lesions can cause irreversible scarring on the face or back. And we all know that the society judges us by the way we look, and even after the acne goes, you still have something to remember them when you have those scarring pits in your face and in different areas. and it's very hard to treat after the scars after they are formed. So the whole talk about today is how to avoid the scars by early treatment. So if you have scars, what can you do? First of all, you need to search for a skin specialist, a dermatologist, or a plastic surgeon that is certified and is experienced using modalities of ablative treatment like CO2 lasers. And each scar is different than the other scar, and they should explain to you what is the best role that they can offer you, and to cause scar blurring or treating the blemishes that you have there, because it should be individualized, and usually it costs a lot, and the patient should understand that what is the end result after paying so much money to try to clean the scar. It's not so easy. So today we wanted to emphasize how we can treat acne vulgaris by another modality with the 3D IPL of with the applicator of the S430 nanometers with the alpha system. So the 3D IPL is the newest IPL from the Forma-TK company, and it's the newest technology, and I will explain what it does. So first of all, what are the contraindications of treating acne and IPL? Cancer, severe diabetes, active herpes simplex, skin lesions of infection that are non-related to that, tattoos or permanent makeup in the treated area, severe tan skin in the last 3 to 4 months, pregnancy, any other clinical condition considered inappropriate by the family doctor or the dermatologist. You should consult the family doctor about anticoagulant therapy if the patient can change it, or consult with the doctor if how we can manage it, and also self-immune diseases like vitiligo. If you have epilepsy or thrombosis, you should it's also a contraindication. But anyway, if you have doubt if you can or cannot, then consult with your dermatologist and according to the laws and regulation of your country. So what is the aesthetic market evolution? So you see from one side you have psoriasis, on the other side you have hair removal, but in the middle you have acne treatment, and phototherapy and IPL is a high demanded growing from the public and the market. So how does it really work? So exposure to sunlight was reported to be highly effective to treat acne, and the efficiency up to 70%. So sunlight decreases the androgenic hormones in the sebaceous gland, but unwanted effect of exposure of UVA and UVB limits sunlight for the treatment acne. So if you have too much UVA and UVB, you might get cancer from the skin. So UVA from the sun directly is not that good. But we found out that phototherapy with visible light, mainly the blue light with the 430 nanometer, is being used to treat acne, and we will explain why. One of the mechanisms of action of phototherapy for acne is the absorption of light, specifically blue light, by the porphyrins, mostly copoporphyrin free, that P. acne have produced as part of its normal metabolism, that act as endogenous photosensitizers. If I need to explain it better, then the P. acne that lies inside the hair follicle, we are using its own mechanism against it. It absorbs light in the 430 nanometer, and when the light hits it, it becomes chemically active. There is free radicals and oxygen species that are there. It leads to basically to the bacterial destruction, causing membrane damage in the P. acne, and the P. acne dies. If you have less P. acne, then you have less acne in general, and you don't danger the tissue around the P. acne. So basically, the trick was to find out to which wavelengths the P. acne is most sensitive to from all the spectrum of the visible light. So this is how the P. acne looks like, and this is like ultraviolet light or Woods lamp, and those red ones are the targets inside of it. So this is a simplified version. You have the P. acne, you have the porphyrins which are red. So here is the traffic jam, you have light, and then you just stay with the green and you don't have the reds anymore. Okay, so and the greens is much less as well, so no acne. Okay, so basically each time you treat, you reduce the number of acne in the area, and basically the rest of the skin is preserved. So what are the advantages? So if you're using IPL, you have the expectancy to help elevate the cause by 70 to 80% in series of treatments with before and after comparison, and I will show you some. There is no restriction to physical activity like you have with oral treatments with certain medications. There is no need to swallow pills, capsules, because some patients are unable to do those. They are afraid of taking pills. There are patients who have developed side effects for treatment with the pills, or whose medical condition for any other reason doesn't allow treatment with the pills. Maybe they took it and had an adverse event with the drug, so they can't return to it. There is no need for laboratory monitoring before, during, and after the treatment. In women, you don't need to do a pregnancy test like traditionally you were required before you're using oral vitamin A derivative. So you need to ask if the female patient is pregnant right now before the treatment begins, or is she planning pregnancy, but you don't have to do mandatory pregnancy test every time she comes to renewal for the treatment like you have to do with the drug. There is no limit to blood donation as in oral treatment with vitamin A derivatives. There is no it's not considered painful. Treatment dates can be adjusted according to the patient schedule, once a week, once every 2 weeks, depends on the how you manage with the treatment. So if it comes every week and it's fine, then you can make sure that the next treatment may be in 2 weeks, or if it becomes worse and if you do every 2 weeks, then do it every 1 week. You should remember that IPL treatment can be combined with local and maintenance specific treatment, because it's not only the treatment, you also need to educate the patient on what to do when he's at home. In between those two, each treatment that he comes, he has a window that he's not with you, so he needs to have a regime as well and to understand his acne better. Okay, so you can combine it with this, and basically so it's education and treatment at the same time. So we have here, for example, from Forma-TK, a case study that was done on an IPL with 414 nanometer. This was done with the Forma. It's an older version, and we had good results here. We have here another publication that was done with a different system, an older one that's called Magma, and here it was done on an Indian population with grade 3 to 4 acne, which is considered severe. And we had, as you can see here, results that are quite good, even in dark skin, and with 6-week time period. So it's quite promising. And here you can see the results that erythema improved for 82%, the papules improved by 75%, nodule improved by 81%, and pustules improved by 81% here. You can see, one moment. And basically, if you want to read more, then please Google Despeinage efficiency and safety of evaluation of high density in test pulse light in treatments of grade 2 to 4 in acne vulgaris as monotherapy in dark skinned women of childbearing age. So it was published in 2018. Beyond this, we have another breakthrough in 2022. Usually doctors, they won't say that IPL is the first line treatment for acne. The first one will be topical, and then you'll have drugs. But in 2022, there was a groundbreaking experiment that basically they treated as a first line for moderate to severe acne vulgaris of chest and back. So we already know that chest and back acne is much harder to treat. So to treat it in as a first line treatment, they did it in Rome, Italy in 2022, and they published the results about wavelengths 400 nanometers with fluence 8 to 9 joule per centimeter, and one treatment per session for 4 sessions with 2 weeks interval. So it wasn't done before that in a clinical test. And you will see the results. So they treated them until 5 sessions. So you can see here the back before and after, which is a great result. Again, before and after. And here again, before and after. What you see here is the scars that were left after the treatment was over and the active lesions were gone. So basically here it will be like keloids or something like this. And so it was considered very severe. So even here you have more treatments, and you can see here closer for the results, and it's quite impressive. Usually if you would go to a dermatologist and you show him this case, he will tell you absolutely this is oral antibiotics, this is maybe even with prednisone, this is you'll have to treat with isotretinoin and not with IPL. So this is a new way of thinking about it, that if they have managed to do this kind of great success with IPL alone, with the grade 3 and 4 of severity of acne, then IPL for the grade 1, 2 is a great option. So what do we recommend in Forma-TK? How do you do the protocol? So you have to review the treatment procedure with the patient and have the patient sign informed consent and explain to the patient that it takes time. It takes between 4 to 6 weeks if you do it every once a week. If you do it every 2 weeks, then you might even make the treatment numbers longer. You have to explain to the patient that each person has a different causes for its acne. So in 1 week it might be even more severe than the rest, so you need to adjust. So you start with your normal routine and the way that I will show. And if you see that one of the acne nodules became stronger in between 2 different time periods, then you can increase the joules for that specific nodule using the stencil. Okay. After you explain to the patient, and if the patient is younger than 18, then both the parents should sign in informed consent form that they allow you as their legal guardian to treat their child. Make sure that the area you intend to treat is hair-free, so you don't burn with the IPLD hair. Clean treatment, you have to clean all the residues of the makeup, creams and lotions if the patient came with them before. Take photos, I emphasize it, of the before and after from each angle, and make sure that it's always the same angles. Okay, it's very important. Patients tend to forget how they looked like before, during and after. It's the human memory. What I also advise is that when you take the photos, you should count how much active lesions there were in doing each treatment. Okay, because if the active lesions goes down, then it's actually a testimony that you have managed with your treatment to successfully eradicate the P. acne. In the first session, it's recommended to perform a deep facial antiseptic cleaning, reduce the disinfected papules and pustules. If necessary, proceed with adequate peeling and wait a week, and only then treat with the IPL. So you have to prepare the face. Make sure that all the people in the room wear protective glasses, also the operator and also the patient. Perform a patch test and wait 5 to 15 minutes to see what is the end result, and if the patient can, from pain-wise, and to see how the reaction is going. It's essential to press simultaneously the foot switch and the applicator to deliver the first pulse. So how do you do it? That was the preparation, and now performing the treatment. You should select the relevant parameters according to the skin type, acne stage and treatments. We have the melanin meter, Okay, with the alpha, you just put it on the face, it gives you the number, you adjust it into the screen, and it gives you the correct parameters. And I always use the Parker gel 1 to 2 millimeters on the face. And for example, if you want to protect the rest of the skin, let's say you have 1 or 2 purples and the rest of the skin is cleared. So you take the stencil, and basically the stencil is white. It will reflect all the light away from the areas that you don't need. Okay, and then you can work safely on a specific lesion, which I mean the inflamed active lesions. Only on them we work with the IPL. After that, you clean the gel, you put the sunscreen, and you tell the patient how to behave until your next meeting with him. And I recommend that before and after each visit, take photos. So here you can see an example of cleaning the face using the milling meter to choose the correct jowls and the parameters, which will give you a more precise end results, and also patient safety. Use the Parker gel. The Parker gel also cools the skin. It provides protective to the skin protection, and basically also takes the IPL and concentrate the beams to where you need them to go. So only work after you have the gel. So this is the this is the handle of the alpha, and you attach it to the skin, you shoot the beam, and you move on until you end up with the active lesions. Here you can see the QRG, so what you do for, let's say, stage 1 and 2, and what we call slight to moderate inflammations. According to the skin type, you have the fluence, the operation mode, the pulse duration, and the tip temperature. I wanted to inform you that with the 3D IPL, why it's called 3D, because you can choose both the fluence, the operation mode, the pulse duration, and the tip temperature. Not every IPL you can adjust the temperature to your likings. The additional cooling, you can it will also be easier to treat the patient. For example, if it's painful for him for some reason because of the IPL flash, when you put the gel, you can use it with the tip, with the cooling itself. Before you flash it, you can just massage the face with the cooling area, and it's like ice pack. So you talk with the patient, you cool down, and then you do the flash in case they are very, very sensitive to pain, and pain is individualized. Here you see photos from before and after using the IPL for acne. So here it's an example. Here you see it's the 430 handle from the Forma, so it's cooled with air, so it's a bit noisy. With the alpha, you don't have this noise, but it shows you here exactly how the procedure is going. You put the gel, and you go lesion by lesion, and you give a pulse to each one. Here you can see before and after with the 3D, with the S430, use 19 joules per square centimeter, single mode, and hertz 1 hertz, before and after. Here you can see it with the F Acne, it's with the Forma, it's sold in Israel, and you see it before and after. But the main idea is that the F Acne is basically 430, just with an older model, that doesn't have the 3D cooling device like you have with the alpha, but it's the same bandwidth. Here another example of before and after, and here as well, and as well here. So if I want to summarize after almost 50 minutes of talking, when you have mild acne, let's say just with comedones, then topical creams and solutions is great. If you have mild and moderate, and the person cannot or doesn't want to take drugs because of, let's say, sports, work activity, any other contraindication that he just cannot, and then IPL is a great solution, and it almost has no side effects. The average treatment are between 4 to 6 treatments with 1 week interval, and the IPL is a great way because most people don't know that it's an option, and it's quite safe option and very target specific, so it won't affect healthy skin. It will just affect the P. acne inside an active lesion, and the results are quite good, and the information from the scientific community is excellent, so why not? So thank you for listening about the option to treat with the alpha with the S430 handle, and to treat about that, which talked about the treatment possibility of acne with also with IPL, which is easy to do from the operator side of view, and it's another great way to use the alpha. So thank you for your time, and if you have more questions, I'm always available. And thank you for having me as a guest here, and have a great day, and I wish you that we'll meet in other webinars as well about Forma-TK and our capabilities.